Hi everyone. Today we are going to learn about a major concept in healthcare called interprofessional practice, sometimes abbreviated as IPE. So if you ever see IPE or IPP, interprofessional education, interprofessional practice is what they mean. Major concept, and I am going to pack this presentation full of information for you, so much so that I think I want to do a two-part series to allow some of it to absorb, just so you kind of have a break in some of the information. There is a PowerPoint to go along with both of these videos that I'm going to ask you to watch today. So if you'd like to follow up with the PowerPoint slides, you're welcome to do that. Some people like to take notes on them or just follow along that way. But right now I'm going to share my screen. And again, this is the PowerPoint that you have access to on Blackboard, titled Building Bridges in Healthcare Through Interprofessional Education and Practice. So let's start right into this. The first slide of the PowerPoint talks about some objectives that I would like for you to be able to accomplish after viewing both of these videos and doing a little bit of work online, looking up some of your own information. So the first one, basic, defining concepts and terminology regarding, and there's those words, interprofessional education, interprofessional practice. And like I said, abbreviated IPE or IPP. So either way, you'll see those. I'd like you to start thinking about opportunities and challenges for health science students in IPE and IPP. Whether you're a health science student or not, you should be able to see some opportunities as well as challenges. The third objective, pedagogical strategies for inclusiveness, what that means is how are interprofessional education, interprofessional practice opportunities, how can they be integrated into what you're doing at North Central College in a bachelor's program? How can they be integrated once you may go on to graduate or doctoral level type of programs? And then we are going to try this out through a case study. So that's kind of what we want to accomplish today. First thing, interprofessionalism is not a new concept. So Dr. William Mayo, back in 1910, so over 100 years ago, talked about how it's of the best interest of the patient to be considered by a lot of different forces, not just one physician, one therapist, one individual, but when someone's sick, when someone is in need of medical services, they have the most benefit when a lot of different people with a lot of knowledge in advanced medical types of sciences are all contributing. So that's what we're going to look at today. Interprofessional education and practice. Medical and healthcare professionals have long embraced this, but it was not included in institutional. Institutional means schools, government, or international levels. So what this means is a lot of times until recently, you would learn about how to be a physician assistant, how to be a doctor, how to be a social worker within a school program. But you only learn of it, we call it silos. You're only learning about that specific program, and you're kind of ignorant to other professions being out there. You don't work with other professions while you're in your graduate programs, and you're just solely focused on learning that graduate program. Then what was happening is you get out into the real world. You start your first job at that hospital or that clinic, and all of a sudden you learn, oh my gosh, there's these other medical professionals who have different backgrounds than me, but are contributing to the same patient. And they're bringing their knowledge in, and I actually have to work together in the medical or healthcare world with them. So it was kind of a backwards thing where it was almost a surprise to these young graduates that were coming out into the health world to say, wow, I didn't realize I would be part of this team. And that's why we say that once they're out in that real world, that hospital setting, that clinic setting, professionals have long embraced this idea of we're a team out here, and each person is coming in with different knowledge. but it wasn't really being taught in the academic side. Oh, sorry, let me back up here. As a result of that, in the early 1990s, so 30-ish years ago, starting with medicine and nursing, they said, we need to teach this concept of working as a team with other medical professionals while the student is in school. So now we're talking about it in classes like this Intro to Health Science class. And then for those of you that do plan on going on to clinical focused graduate work or medical doctorate programs, you'll see that this concept of interprofessional education, talking about how you will work with other medical professionals once you get this degree, is being focused on within those curriculums. So it's an exciting time now over the last 30 years because we're really meshing together, giving an accurate picture of what it would be like when you start practicing. This is one of those objectives that I want you to do, is to be able to define multidisciplinary versus interprofessional. The words, when you break them apart, look fairly similar when you're thinking from a medical terminology perspective. We'll take the word multidisciplinary. So taking the prefix multi, meaning many, we're thinking, okay, so it's a lot of, and then disciplinary, disciplines. Whereas you look interprofessional, between is inter, and then professional, disciplinary and professionals could go hand in hand. It's a discipline would be occupational therapy as a discipline, or therapy services, whereas an occupational therapist is a healthcare professional. So the difference here I want to illustrate in some of your favorite McDonald's treats here. We've got the fruit and yogurt parfait on the left and the smoothie on the right. So multidisciplinary is going to be like your McDonald's fruit and yogurt parfait. Where many disciplines, you see by the layers of the parfait. So we've got the yogurt on the bottom. That is, name a healthcare discipline, the rehab services. So physical therapist will say. And then we've got different fruit in the middle. Let's call that a radiologist. And then another layer of the yogurt there. Maybe that's a nurse. And then the granola crumble on top, maybe that is a speech and language pathologist. So you can see lots of different disciplines. And in multidisciplinary care, those different disciplines do not interact, they do not work together. So they're not sharing information both in person or through an electronic medical record system. There's no exchange of information. They may be working on the same patient, but they're not communicating in any way. Versus, we'll move over to the smoothie here on the right side. Interprofessional is a blending together. All right, so again, we have a lot of different disciplines working together. Maybe we still have that nurse and that speech pathologist and that doctor and that physical therapist. So same people that were working in that multidisciplinary team, but now all of a sudden they're working together and they're communicating on their patient. Big, important, really, really, really important thing here. In interprofessional care, the smoothie approach, we'll call it, does not mean that that physical therapist now has the same knowledge as the nurse and they could just interchange their roles. Absolutely not. That nurse went to specialized schooling to do his or her skills and learn a very specific trade within medicine. Does not mean that the speech and language pathologist can march into the operating room and take over for the cardiothoracic surgeon. Absolutely not. I do not want a speech and language pathologist doing cardiothoracic surgery on me. What a disaster that would be. Instead, the smoothie approach means that these healthcare professionals are all working together on a patient and they're sharing their specific knowledge. So it's a collaborative effort. They're saying, hey, I'm an expert in rehab. I'm doing this on the patient. Now I'm going to listen what you're doing with the patient because you're an expert in laboratory studies or whatever the other healthcare professionals are. So interprofessional medicine means we're all working together. We're all sharing what we're doing, and it's a collaborative effort to help that patient. So you can see the difference, I hope, and think of that parfait and smoothie when you see these two words. These are the official definitions of interprofessional education. And so I'll let you take just a minute to read those. I won't read them on this video here, but you see different words here. Both definitions have the word collaboration, so you see that. And you can see that it involves multiple, 2 or more professions is what is defined by that. So 2 or more. So just 2 different professionals working together could be an example of interprofessional education or interprofessional practice, absolutely. Or it could be 5 or 10, or maybe there's a really, really complicated case where you've got 15 or 20 different medical professionals that are all working together on one patient. Again, same concept of interprofessional education, interprofessional practice, just a much larger scale, way more communication and collaboration needed if you've got 15 or 20 people working together versus 2, but we're still going back to the basic definitions here. Interprofessional practice, again, remember the abbreviation IPP, says that all healthcare professionals should be educated to deliver patient-centered care. Patient-centered care. That's a concept that we will talk about within health science quite a bit. Patient-centered care means that we are focused on what is best for the patient. Okay, exactly what the word sounds like. So it's how it's defined. What is best for the patient? We are going to focus on what outcomes would be most appropriate for the patient, what do they need, and what is the best way to get there. And patient-centered care looks at the patient in a more holistic view. Okay, it's not just here is a 15-year-old kid with a torn ACL, and so all we're focusing in is the knee and the ACL tear. Instead, we're looking at it more holistically. What are his needs? Is he an athlete that wants to get back to sport? Does he have a good support system with his family and friends and coaching staff? How can we best assist him in getting to his goals? So he's more than just an anatomical need that has a disrupted ligament. Instead, we're looking at it more holistically. Evidence-based practice is also a word that we see in this definition here. Evidence-based practice, another major concept, I would say just as big as interprofessional practice. In fact, for those of you health science majors, you'll have an entire course on evidence-based practice that's offered in the spring semester here at North Central. So evidence-based practice means that we aren't just doing whatever we think is right with the patient because that's our best guess. Instead, we're utilizing scientific research that's of high quality research, as well as our own training from our schooling programs and our experience out in the clinics or hospitals or wherever that we were practicing. So we're combining our training, we're combining our knowledge and skills just from working in that area. We're combining scientific evidence, and we're focusing on what are those important qualities in that patient-centered care team to that patient. So what's important to them? Is it important they get back to high school athletics, or is that not important? So evidence-based practice takes into part all of those things, and we'll learn so much more about it in a different class, but know that evidence-based practice is a very important term, so don't just skim over that when you see words like that. When we're talking about interprofessional practice, so again, remembering back, not the parfait, but we're talking about how do we become that smoothie from the multidisciplinary. So how do we turn multidisciplinary into the smoothie approach or interprofessional practice? You can understand how when we start mixing everything and sharing our information with other healthcare professionals, collaborating on different patient goals. So again, we're no longer just working by ourselves to address this patient. Instead, we're working with all these other healthcare providers. You can see how the framework for effective interprofessional practice requires a lot of different things. Shared goals. We all have to be working towards the same thing. We all have to agree, this is the goal we have for this patient. And this is, then we can see how each person is going to contribute as we work towards that. Clear roles. This is how I kind of joked earlier that you're not going to have the speech language pathologist in the operating room. Each person stays within their lane of training. So the physical therapist becomes the expert in physical therapy, and they stay within that lane. They are the rehab providers. The surgeon stays within the surgical lane. Okay? They don't become the physical therapist and make recommendations now on how we should do the rehab. So clear roles. This is what this person is going to contribute to this collaborative team. This requires trust. Okay? Again, when you're working in interprofessional practice, you are part of a team, and you're not by yourself in the individual layers of that parfait. And instead, we are trusting that the other healthcare professionals that are bringing their knowledge, we're trusting that they have done the work to become good in their field and they know what they're talking about. We trust that they are focused on those shared goals. We trust that they're going to communicate with us of whatever is going on within their lane or their role. So again, that effective communication is another framework. And measurable outcomes. So we want to know, how do we evaluate if what we're doing as a team is even effective? So these are the frameworks for IPP. Collaborative patient-centered practice, CPCP, is an interprofessional process for communication and decision-making. So patient-centered practice I talked about just a little bit ago, where we are focused on what is best for the patient in a more holistic approach. And collaborative, meaning we're all going to work together to to address patient-centered practices, means in an interprofessional way, we are going to communicate, to collaborate, and to make decisions together that provides better care for the patient. It leads to this synergy. We're all working together with shared goals in a way that is focused on that patient. What this does when this collaborative approach is taken, it enables us as separate healthcare professionals, so that expert in nursing, that expert in audiology, that expert in occupational therapy, can all come together and share their own unique knowledge that they have in their respective disciplines, then contribute that to that patient, which provides this amazing synergy, lots of different opportunities, and sometimes can teach other professions about things that they didn't even know were options, that may be wonderful things to promote the health of that patient. So interprofessional education and collaborative patient-centered care can positively impact many different things. This is a list. What I'd like to do, I'm going to talk about some patient outcomes and how that can help. But what I'd like to do at this point, this is slide number 10, if you're on your PowerPoint following along. I'm going to stop the video here, because what I'd like you to do after I give an example of one is I'd like you to look up and you can do a Google search for this, but I'd like you to go on and type in either IPE or CP, or spell out the whole word, and look up that versus any one of these, and find yourself some examples of how how interprofessional education can actually positively impact accessibility, primary health care, chronic disease management. Try to answer in more detail one of those. So the one I'd like to focus on here is, let me stop sharing this screen, sorry. There we go. So I'd like to think about patient care and outcomes. So let's think about a patient that walks into the emergency department. Let's say they're complaining of chest pain. First person that might see them is the emergency room doctor. It's going to check them out. And then maybe they call in the cardiologist because they say, okay, chest pain equals probably heart. So the cardiologist comes in, the heart doctor, who's going to order some tests, and they're waiting on the test results from a radiologist, another type of doctor who specializes in diagnostic procedures and reading those. The radiologist confirms what both doctors, the emergency room doctor and the cardiologist, suspects: patient's having a heart attack. So now we've got 3 different specialists, 3 doctors all working together. So let's move forward now. Patient's having a heart attack. He's in the emergency department. So they rush him in, have emergency surgery. Patient then spends the day in the intensive care unit of the hospital, where a team of nurses care for him in 12-hour shifts. Remember, he's going to have multiple nurses working with him. And then they transfer him to a cardiac unit, where he meets a new round of nurses in the cardiac unit. So he's been in the emergency department, the ICU, and now the cardiac unit for a couple days, had many, many nurses working with him. Each morning throughout his stay, let's say a hospitalist, which could be like a primary care doctor, but the hospitalist focused on just kind of overall wellness, stops by and does rounds. So does the cardiologist. And since, let's say, the patient has diabetes and COPD, an endocrinologist and a pulmonologist, 2 other types of doctors, also stop by. And that's every morning. So you've got multiple doctors stopping by every morning. Depending on the patient's recovery, lifestyle, maybe physical therapists, dietitians, social workers, they may be involved and stopping by to check on the patient or making recommendations. Each one of the people I just recommended, each one of these healthcare professionals that are stopping by, rounding on that patient, has a really unique perspective, valuable insights about that patient. They may notice different symptoms. They may consider different possibilities as far as treatment goes. Together, when all these people are working together, they have a more comprehensive and holistic view of the patient. But rarely, let me stress that, rarely, even though they're all in the same hospital, rarely, if ever, are they in the same room together. At best, they share their data via an electronic medical record system. But they often lack this communication in real time. Along with the care team members, many hospitals now encourage team-based, patient-centered rounds. So many hospitals are encouraging that often include like the primary care doctor, a bedside nurse, maybe a specialized physician, any other relevant team members. So this can help foster both patient-centered care and interprofessional collaboration. So do you see the difference? First one, multidisciplinary care. Second one, that team-based team rounds is now interprofessional care. They're rounding together. So they are communicating in real time. Hey, here's what I see. And they're all in front of the patient. What are their goals? How are we going to address this? Okay, this specialist may have this advice based on their background. So you can see how this really promotes that interprofessional collaboration. Exciting thing when that's done. Another one I want to really quickly go over, I know I said I'd do one, I want to just cover really quick, medical errors. So this is patient safety. Alarming fact here, medical errors in the United States alone cause 250,000, 250,000 deaths each year. Unbelievable fact. So that is somebody that may or may not have actually survived their medical condition, but because of missed symptoms, misdiagnosis, medication errors, all those go into the umbrella of medical errors. Also communication gaps. Okay, this an order got dropped or misunderstood. That's a medical error. All these contribute to that alarming statistic of the deaths per year. In fact, medical errors are the third leading cause of death in the US alone. It's kind of easy to see how accidents could happen when you think about these multiple doctors prescribing multiple medications, numerous nurses delivering these medications. Think what I just explained with that patient that came in the emergency department with a heart attack. Easy to see how when you've got multiple nurses rounding all these people, that accidents can happen. The electronic medical systems can help, certainly can help, but the clinical communication is vital. Okay, them actually getting together, so rounding together or having a group conversation, looping in the pharmacist maybe for that interprofessional collaboration, having that conversation in person will help reduce that. So studies have shown that when people come together in an interprofessional collaborative way, often in real time, we're actually communicating face to face, it can reduce preventable drug reactions, decrease mortality rates, meaning decreased death, and optimize medication dosages. So what's the best dosage to give them? So lots of different improvements that we have seen through interprofessional collaboration. So I want to pause there. This will be the end of this recording. I'd like you to take a breath here. This is a lot of info to absorb. And then go online and try to look up one of those other bullet points of how interprofessional collaboration can actually improve one of those other bullet points. After you do that, come back enthused for the second video that we will talk about interprofessional education. So how are you going to be exposed to this while you're in different healthcare programs and doing different types of training? And then at the end of the second video, I'm going to give a case study talking about a real person that actually went through a very, very major type of an injury. And I'm going to show how multiple people work together on him. So I'll see you for the second video.